Hi, my name is Brianna, and today I'm going to be talking about the relationship between simulation in nursing education and medication safety. So, the research hypothesis, as stated in the study by the researchers, was that the students' experience in the simulation lab would increase the students' ability to safely administer medication in their respective clinical area. So basically what they were saying was that they wanted to test to see if there are fewer medication errors with more education. So there was no model or framework used for the study, but the design of the study was that the researchers used a randomized control group with a post-test only design. So, as stated by the researchers in the study, they established the problem as medication errors in nursing students. They wanted to determine whether or not a simulation would help them pass medication in their clinical area. They established the research question as, does the use of a simulation by second year BSCN nursing students influence the student's ability to safely administer medication? So when we talk about this study, the variables in the study, the independent variable was the use of a simulation by second year BSCN students, and the dependent variable was the amount of medication errors when they got into the clinical area. The research variables were how old the students were, whether or not they studied when they came into the medication simulation lab, the GPA of the students, and whether or not they had prior experience from their jobs for a medication administration. So the sample in the study, altogether, there was 54 students who voluntarily signed up for the study, which 24 of which had no medication simulation, and 30 did have the medication simulation lab. 26 of those students were placed on a medical surgical floor, and 28 were placed on a maternity unit in a totally different hospital. The groups were constrained because there was limited placement availability in the hospitals. So as far as ethics go, the researchers sought ethical approval from Researchers' Ethics Board in Canada, which is similar to the Institutional Review Board in the United States. The students consented to be in the study by voluntarily signing up for it. So as far as the intervention goes, being that the question of the study was that if the students had a medication simulation, will there be less errors in a med pass when they get to the clinical, The intervention was to replace early clinical hours with exposure to case studies related to their medical surgical unit or their maternity unit. Also, all of the students were in a pharmacology course, and they couldn't pass medication until the 7th week of their pharmacology course. This made it fair for the treatment group and the control group. So as far as the data collection goes, the data collection procedure was adapted from a previous study which was done by Kimberly Sears, who is one of the researchers a part of this study. It took the form of a questionnaire which was filled out at the discretion of the clinical instructor each time a medication error was made. The form stayed completely confidential and did not include any demographic information about the students who made the error. The questionnaire was then reviewed by head researchers and kept in a safe place. So the limitations of the study, as stated by the researcher, was that there was only one school involved in the study, a school in Canada. They were in a separate hospital, so one system of medication administration in one hospital may have been easier than the other hospital. and there was different clinical instructors, so there could have been biases. This made it hard to generalize the findings, so the researchers suggested that the study be done on a larger scale to determine whether the results stayed significant. So for the results, the researchers used a chi-square test and the Poisson distribution. They realized that the results probably would be better interpreted by using the Poisson distribution, but both tests were used. Both tests came back highly significant, and the mean was right skewed. They found that there was 7 errors in 24 students who had the simulation, and 24 errors in 30 students without the simulation. The results were also determined to be highly significant. So the implications of this study is that this is very useful for nursing because its findings suggest that the simulation education may contribute to a reduction in medication errors among novice nurses, therefore keeping patients safer from medication errors. It also increases confidence in young nurses and gives students an idea of what to expect when they get into a clinical setting. So in the study, it states its findings suggest that simulation education may contribute to a reduction in medication errors among novice nurses. So what does this all mean? Being that the results were highly significant, it seems that having a medication simulation prior to a clinical med pass will decrease the likelihood of errors among students. Would the results be similar if it was replicated on a larger scale is yet to be determined. So thank you for watching and have a great day.